So today we understand the root canal treatment, which is done in a milk tooth. So let's see first the parts of the teeth. Okay, what parts are there in the teeth? So the outermost layer is called the enamel. The second layer is dentine, which is present all around the tooth. And the third layer is the pulp. The pulp consists of nerves and blood vessels. These nerves and blood vessels enter the teeth from the bone. Alright, and this is what keeps the teeth alive. Now, if you see a milk teeth X-ray, a primary dentition X-ray will look like this. Okay, so what is there on top is the milk teeth, and what is developing between the roots of these milk teeth are the permanent teeth. Alright, here as well you can see those. So these are present inside the bone at the time. So these are younger kids which are lesser than 8 years of age, 8 to 9 years of age. Now let's see the progression of cavities. So progression of cavity shows that the initial decay is present only in the outer layers. Okay, so this is an enamel. This has progressed further into enamel. This has gone into the second layer, that is the dentine. Now this is when the pain can start. You can have sensitivity to sweet, sensitivity to cold. The next stage is when it has entered the nerve, and in this stage it has to go to a root canal. Okay, so now what does it look like? So this is how a smaller cavity looks like. The enamel is infected, the dentine is infected. As the caries progresses further, that is, it goes down into the tooth, now it has reached the nerve, and this is when you will have pain. This is when the irritating pain starts. When you lie down, when you bite onto something, or maybe just like that, it will start paining you. So this is the stage when it has entered into your nerve and blood vessels, and all the bacteria and the inflammatory toxins have started infecting this portion. It can, if left like this, it can progress into the second stage where it goes down and infects your bone. Alright, so here where you can see that the inflammatory products are present here, the bacterial products are present here, and there is pus formation often. If this is left like this, it can progress into swelling of the face as well. So now here you can notice that in this stage, all of this infection is present around the developing teeth. Alright, this is the permanent teeth. So we don't want this infection affecting our developing permanent teeth in any way. And therefore a treatment is very necessary whenever you see deep caries in milk teeth. So now what does the treatment procedure actually look like? So the treatment procedure is the root canal treatment. So here we open up the pulp chamber first. In the second stage, we clean up the chamber, then the inside, the canals are completely cleaned. So these are the root canals. These are completely cleaned, and then they are filled with an appropriate material that will resorb as the teeth resorbs and the new teeth comes. Alright. So this is how carious teeth look, and when they are restored, this is how they look. Alright. So what you see here are silver crowns. Alright. These silver crowns are put on the teeth after a root canal treatment. So when you see in an X-ray, the root canal treatment will be seen as filled up roots. Alright. Only in kids, there are two types of root canal treatments that can be done, pulpotomy or pulpectomy. But it is the clinician's call as to how much the inflammation is, and accordingly they'll decide which one is appropriate. And on top of all, this crown has to be put because we need a coronal seal. We need it to be not get infected again from top, and therefore this is necessary. So this is entire completion of a root canal treatment in a milk tooth. And here as well you can see, appreciate the developing tooth buds. Can you see these things down? They are the developing tooth buds. So there are these kind of silver crowns that can be put, and some may go for aesthetic crown or a white crown. You see here is a zirconia crown. So these crowns are teeth colored crowns. Alright, and this marks the completion of the root canal treatment. Thank you.